Today in D for Therapy, we will talk about how to diagnose using DSM-5-TR in 5 minutes or less. Diagnosing can be very tricky. For someone who's new to it, it can be a challenge to learn how to organize the information that either the client is telling you or that you're reading in your DSM in any meaningful way. So let's see how it can be done. It can be useful to think of the criteria of a disorder in the following categories. So the criteria of symptoms, the criteria of time and duration, what is the intensity, and what is the frequency. The criteria of symptom can be divided into 4 different categories as well. The category of thought, behavior, feeling, and beliefs and experiences. So let's take an example of social anxiety disorder or social phobia. Here, the thought can be that I'm going to embarrass myself or people will scrutinize me, and the behavior leads is avoidance. The person feels anxiety, and maybe the underlying belief is that they're not good enough. Thinking of symptoms in this manner helps you organize them and gives you a fuller picture of what the client might be experiencing. The DSM almost always provides you with a time or a duration for which the symptom has been present for that symptom to qualify for a certain diagnosis, right? So an example can be social anxiety, which has to be present for 6 months or more. Mania, a manic episode have to be there for at least a week, or if not a whole week, they probably were detained or hospitalized, etc. For someone to get a diagnosis of persistent depressive disorder, it has to last for at least 2 years in adults or 1 year in kids. Another example can be to give a child a diagnosis of DMDD, it has to be present, the symptoms have to be present for at least before the age of 10, etc. Knowing this information is especially helpful when you're trying to take a test for licensure, and this helps you kind of distinguish, this can be kind of the deciding factor between, like, let's say acute stress disorder or post-traumatic stress disorder. When talking about frequency, the DSM usually tries to stay vague about what the frequency should be. However, they kind of suggest language like most days than not. So for depressive disorder, sad mood or depressed mood have to be present for more days than not in an episode of 2 weeks, let's say, right? Or they would say something like almost always. So in a case of social anxiety, the person almost always is having kind of an anxious response to social situation, right? Another example can be of premenstrual dysphoric disorder. They would suggest that majority of the menstrual cycle, so there's not like a specific like requirement, but majority of the cycle, right? So they try to keep it vague, but this kind of like guides the clinician to ask questions in a way that kind of helps us understand the frequency and hence the severity of the symptoms. The language that is used in the DSM to talk about the intensity of something is usually clinically significant distress, right? So how do you know if the distress is clinically significant? So you can check for if it affects their person's occupation or school, if it affects their social life, of course it affects their mood or judgment, etc., right? So if parent cannot make it to their child's performances or cannot pick them up from school, or their mood is bad all the time, they're spending a lot of money, poor judgment, or they cannot hold a job or failing a class, etc. So this is when the distress becomes clinically significant. So quick recap of the 4 categories of symptom, time and duration, intensity and frequency can be used to categorize the information that you read in DSM or that your clients are telling you. I hope this was helpful, and if it was, please let me know in the comments below. And if you have found this video to be helpful, please like and subscribe. Thank you.